In this lesson, we're going to look at the mnemonic AIRED, and we're going to use this one to remember what interventions we need in order to manage hyperkalemia, so excessive potassium. So the ultimate goal with this is to reduce the amount of circulating potassium and to protect the heart from any of the dangerous effects of that potassium being elevated. So let's look at the mnemonic AIRED. A stands for administering IV calcium, and the reason we do this is we want to immediately decrease any cardiac toxicity that's associated with this elevated potassium. I stands for increased excretion. What we want to do here is we want to allow the body to bind to that potassium and get it out of the body, and we do this a couple of ways. We can either use it having the potassium bind to the actual stool, and we use this with KX or KX, and the next one is urine. So we want to use potassium wasting diuretics to help get that potassium out of the body. R stands for remove the sources of potassium, and what we want to do here is we want to avoid introducing potassium into the body. So we're going to remove the incoming sources of potassium. So this could be enteral feedings, parenteral feedings, or parenteral sources of it. Like maybe there's one of the IV fluids has extra potassium in it. And also consider their diet and consider anything that's going into their body. E stands for enhanced potassium uptake into the cells. So what does this mean? Well, it's not uncommon to see the use of insulin, glucose, and sodium bicarb used all together. I've very commonly had patients that had extra potassium in their blood. You immediately give them an injection of insulin, followed by an injection of glucose and an injection of sodium bicarb, and it helps to grab onto that potassium and put it where it needs to be and to get it out of the body instead of putting it back into the body. And D stands for dialysis. For patients that have hyperkalemia and there's an emergent need for it, we can use dialysis and different methods to help grab that extra potassium in the body and get it removed out of the body.
Subscribe and click the little bell so you can be notified when our next Nursing Mnemonics video comes out.
Click the little box below for your free cheat sheet.
And did you know we have a free Nursing Mnemonics course? Click the link in the description below and you can take that course for free. Happy nursing.